Hello, everybody. Welcome to this episode of the Pursuing Horizons podcast. Today, I'm speaking with Jonelle Crichton, and she actually owns a couple different businesses, but it's all around disordered sleep, sleep apnea, and some dental stuff as well too. So all tied into athletic performance and everything of that such and nature too. So very excited to have you on today. Looking forward to this chat and looking forward to learning more about this stuff.
Yeah, thanks, Bryce. I really appreciate you having me on here. I think it's going to be
Yeah.
a lot of fun.
Yeah, for sure. So first thing is every guest that we have on, they have to give an origin story, a little background on them. I saw that you competed in a bodybuilding show, so I'd like to hear about that. But I would also like to hear like what got you into your practice, what you got you into the sleep stuff, and then what made you so passionate about wanting to pursue that as a career.
Yeah, so I actually had no intentions of going into anything dentistry. Nobody in my family is in dentistry. My mom's side of the family is actually in law, and I've always felt like that was what I was going to go into. And then one day I was sitting in my orthodontist chair with my mouth open, and I was like, oh, he's like laughing and talking and having so much fun. It's easy. This is what I'm going to do. Blindly, I had no idea that I had to go to dental school and do all this stuff. But I went home guns blazing and was like, hey, I'm going to be an orthodontist. And I know my dad was like, you are crazy, child. Like, you've not looked into this. You have no idea. And yeah, I never looked back. Honestly, I just pursued forward. A bit unchartered. Some may say a little disorganized, however, but I mean, I figured it all out together, was able to apply, and I got into dental school. I think I've had a really fortunate career where I've done a surgical residency. I've kind of tapped into all the specialties, but ortho was really true to my heart. And I guess that was really where I was meant to be because I totally love what I do now and I couldn't go back. And so I went to school in Florida, and then I decided that I still wanted to do ortho after doing some surgical residencies. And I applied and I got into Canada. And so I went from one hot place to a very cold, cold place. And I am still here till today. But after I did my residency, I stayed in Canada, in Alberta. Well, I moved to Alberta actually from Winnipeg. And then I partnered, well, I went to work for what was my partner at the time as an associate. I was only supposed to be here for a year. I was like, I'm definitely going back to Florida. I'll just work. And the day I moved, he put this offer in front of me about buying a clinic. And honestly, we've never looked back. We bought one clinic that year. We bought another clinic by the end of the year. And then eventually I bought him out. And solely I own two orthodontic clinics. Um, Orthos, I love it. It's always fun. We get to engage with so many people. And shortly after I came out of residency, I took a few uncharted courses along the lines of myofunctional therapy. So that's really musculature and function. And, we don't really talk a lot about it in school, but it made sense to me. And so I just continued to pursue along that path. At that time, there's a lot of research out. It's very conflicting. There's a lot of research out from like the 60s and the 40s coming all the way up to present about sleep disordered breathing, obstructive sleep apnea. And at that time when I came out of school, I do believe that that research was again coming back to the forefront. Like our technology was really taking us forward. And so I just continued. You take one course, you meet people, you take another course, and that's kind of, some may say I drank the juice, went down the rabbit hole. But once I started learning more, I realized that I could not unsee what I saw. And I decided that I was going to implement these things that I learned into my practice because it's life changing. And as an orthodontist, we have two areas where we work in. We work in the growth and development sector, and then we work into like the adult past growth sector, so teenagers and adults. And I was like, we're missing the boat on the growth and development area on these kids. And so that's kind of how I started. And now airway is and sleep apnea is all that I do. And I can't look back, and I don't think I'll ever go back. What the changes we've made, the things that you see in these kids and even adults just to breathe better so that they can sleep better is really life changing. Like we say it, we probably throw that phrase around really effortlessly, but the truth is that people feel significantly different. When they feel different, they behave different.
Yeah. So what really inspired you to pursue like the sleep apnea and disordered sleep stuff? Because I know obviously you mentioned like dentistry and like orthopedics kind of being like your main schooling that you did. But what wanted like you to specialize and put more emphasis onto that stuff?
Yeah, so orthodontics, I like I mentioned to you before, I was like, we have this path set out for us, and even though we don't know where that future is, I definitely feel like I was put to go down this path, right? Because if I did not do orthodontics, I don't think that I would have been doing or even pursue the education that I did in sleep disordered breathing and obstructive sleep apnea. But there's a real missing connection, and it's between dental and medical. People don't understand how much the mouth correlates with the rest of the body. And we started seeing and making these connections from a lot of research, like all the research that was out there. We were now actually really taking it to heart. So things like snoring, bedwetting in kids, grinding, mouth breathing, uh, gasping at night while sleeping, restless sleep, waking up at night terrors, nightmares. Those are all signs of sleep disordered breathing. Sensory issues, picky eaters, speech issues, frequent throat infections, and ear infections are also linked to sleep disordered breathing. And so when we have an obstruction in our nose or nasal passage or along that airway, it will create resistance within the body and it will start to develop these sleep disordered breathings. That's kind of a symptoms. That's the foundation. And when those progressively start to get worse, that's when we start to, it turns into obstructive sleep apnea. So once I had got my training down and I started putting the pieces to the puzzle in place when I got back to my clinic, I was like, okay, I have to find a way to be able to put this in, bring this education, and this is how I want to shape the future of my practice. So, starting slowly, you start identifying the symptoms, sharing the education with parents, and you hear a lot of stories. Parents will say, I knew something was wrong. I was told by my pediatrician that nothing was wrong, or my general dentist that they'll grow out of it. And then you start imaging. Like we have all this great technology, like 3D imaging, and yet we're still using 2D images, right? Once I started using my 3D imaging, I can see deviated septums. I can see enlarged turbinates. Now I can get an idea of what's happening with the breathing. Why are they struggling? I can see enlarged adenoids and tonsils, and you see more. The more you see, the better, right? And so, again, just putting the pieces together, this is my area. I was really fortunate in my residency program. My program director liked a lot of what we call phase one, early interceptive treatment, growth and development. So I feel like I got a stronger training than most programs do offer. And I was able to use that to really link with the pieces of those symptoms to change the anatomy. So when we have nasal obstruction, it directly affects the growth and development of the jaws, right? And I always say that teeth are secondary, the bone is primary. And that's the truth. The teeth give us clues as to what's not happening or what's happening. For example, if you have crowding, right? Teeth are coming up one in front of the other, then that's telling us that the bone is not big enough to hold all the adult teeth, right? So if it's not big enough, it's going to be collapsed. That means now the musculature is going to change. Your tongue doesn't have space to fit. So when we lay back at night, the only place it has to go is in the airway. And now we're making that even smaller, right? So once I, again, started seeing these things, I was like, okay, I'm going to find a way. I'm determined to get this out. I'm determined to make these changes. And then you start treating one kid and you treat another. And parents come back with great stories. Like they have better attention and focus. They are doing better in school. They are sleeping through the night. They're easier to wake up. They're not as miserable throughout the day. They're not snoring. They're not grinding. I mean, you hear that, honestly, even still till today, it really humbles me. It makes me so speechless because as kids, they should be thriving. They should be living life, right? That's what we say, go outside and run around and be a kid, right?
Yeah.
And
Yeah.
yet these kids can't. They don't have any energy because they're so tired. And then they become hyperactive. And I'm not saying that ADD is a misdiagnosis. I'm saying that I wish that we would do our diagnosis differently so that we can really evaluate the true cause of what's happening. Because sleep disordered breathing and ADD have identical symptoms. However, you put it in front of a medical person, they're going to treat medically. And that's totally fine. You put that in front of someone like me in the dental field, we're going to treat dentally. And so I think obviously for the future is obviously better collaboration, but it all starts with diagnosis. And I think we need to change how we evaluate and diagnose our patients.
Yeah. And like I think it's a bit of a obviously like a bit of a not super touchy area, but I do think that end of the day, like a lot of these companies are just like wanting to make money off of like long-term medication. And if they're able to put people onto medication for like a diagnosis versus trying to actually find like a more of a solution for something, I feel like that's kind of like the general route that they go. And this could even be the case for like high blood pressure, cholesterol issues, any of that stuff, or even like diabetes too, right? People are so quick to toss people on medication before figuring out what the underlying cause or issue is, and like figuring out like the true causation of why somebody is experiencing like X, Y, or Z.
Yeah.
And really, like even for a fitness perspective or point of view, like if somebody has high blood pressure, like they immediately put them on medication, but it's like, well, what about stress? What about sleep? What about food? What about movement? Right? Like we're not looking at those things first, which could have a larger impact on somebody's health long term versus medication, where it's very much like I always use the analogy of like this big water barrel that's leaking, and I don't know if you've seen that meme where it's like someone will toss duct tape on it and they're like, me fixing all my problems. And it's like tossing duct tape on the barrel. And it's like
Yeah.
eventually this barrel is just going to keep leaking. And
Yeah.
that's like medication, like it's painkillers, it's high blood
Yeah.
pressure medication, it's all that stuff too, because it doesn't actually fix the actual issue at hand
Root
at
cause.
all. It just is giving somebody some temporary like a sigh of relief because they're just like, oh, it's okay for now, until something happens where they have to stop taking their medication or they're on a vacation and they don't have access to their medication or something like that. And then something crazy happens because they haven't changed the actual issues.
Yeah, it's actually quite sad because like there's so many factors to that, right? Part of it is yes, our medical system is inundated, right? Because that's part of it, right? And part of it, part of the fault is I blame us, right? We want an answer now because we've been so down for so long. We want to feel better quickly. So give me a pill. And the other thing that I turned to was, I never knew how many kids were on medication or how much medication until I actually started in this airway field. And I started asking a lot more questions and seeing some kids come in and they're on 7 different medications. I'm like, you're only 9. Like,
Yeah, it's
the
just
only
crazy.
way with the pill is up. And when one doesn't work or you max it out, you add another. And I just feel like in this day and age where we are so educated and tech savvy, we should be asking different questions. Our approach should be different, and that should not be okay. It shouldn't be
Yeah.
okay unless absolutely necessary. And we also have to be okay with having time to like look into different diagnoses. Like you have to go, it's multidisciplinary. It's not just a one-stop shop. You can't just go to one professional and it's going to fix it all. That's really not the reality. And I think like we need to do a better job of educating our public and just changing the reality. I feel like when we know or have the information, we're able to understand things better and do things differently.
Yeah, I think there needs to be more of like a harmonious dynamic between different practices and specialties, right? Like I feel like right now there's often a bit of a divide, and it could be the same thing for like even personal training and physio or personal training and chiro or personal training and massage. But I feel like, most people go to their first line, which is going to be like, their GP. And in reality, like, the GP is going to give them the best, information based off of what they think is the issue, and like they're very like a good generalized doctor. But I do think that, like, again, like you mentioned, there should almost be like this process of like, hey, your issue is more specific to this one area or niche or like anything like that. So if someone comes to a GP with an issue related to the jaw or related to like something to do with their teeth or their gums or even sleeping, right? It's like, well, maybe they should be going to a disordered sleep clinic or going to seek that out versus just being like, okay, here's some medication to help you sleep, right?
Yeah.
Because that's not going to fix anything when really it could be a structural issue, like you mentioned, that's like preventing them from sleeping through the whole night.
Yeah. Yeah, we see that a lot, like the poor quality sleep and just people being okay with it, right? I mean, and I get it. Like I've said that you go down the rabbit hole and it's not as simple as it seems, right? Yeah, stress is related, hormones relate to an effect, but the truth is it really starts with nasal breathing. If you can't breathe properly and effortlessly and silently, like you're going to put so much stress not only on your brain, not only on your nervous system, your cardiovascular system. Like I always say, and I'm not making fun, but I'm like, they say, oh, this healthy person died. They were 42, they were young, they were 60, and they were healthy. Well, in reality, no healthy person should just die, right? So there
Yeah.
is a root cause to it, right? And yeah, I just think like we need to be looking at things a lot differently and be a lot more open to different modalities that are coming up, and just be willing to work with each other, because not everything is fluff and games. Some have some really good benefits, and some patients do really benefit off of some of the isolated treatments.
Do you think, like, because I'm sure you speak with a lot of different people on various different levels, do you think a lot of it is because, like, we grew up in a time now where, like, instant gratification is so high? Like, we talk about that often on here too, like where we live in a time where people don't really have to wait for anything. Like if they want something off of Amazon, you can break it up into payments, but you can also have it delivered tomorrow. If you want food, you can just have it like Uber Eats or Skip a Dish to your house. Like there's no longer that whole process of like even having to drive there, or like if you want to buy something, like you don't have to really save up the money to go buy it. I think it's the time and the age where like if we want access to something, we can really have it like anytime we want. And like even like you look at Google, you look at anything like that too, right? Like there's so much access to information at our fingertips constantly that people are no longer having to wait for information. So I feel like that's almost changed the way that we all think, right? And it's made people impatient. And you see it all the time in fitness too, right? Where people are like, they come to me or they come to some coach or whatever, and they're like, "Oh, I want to lose this much weight," and like in their mind, they think they're going to lose like that by next month. And I'm like, "Oh no, that's not how this works." But I think it's because like yeah, but it's like I think they go online and they see some insane transformation where somebody lost that much weight, or somebody had a major procedure done and they lost a bunch of weight or whatever, and they're like, oh, you can lose 30 pounds in a month. And it's like,
Mm.
no, yeah. But I think at the end of the day, it's just like we live in a time where people aren't really, for lack of better terms, like taught to use that delayed gratification muscle often.
Yeah, I think that's one part of it. The other part that I see from a medical professional side is lack of collaboration, right? Lack
Hmm.
of wanting to listen and work together, right?
Yes.
Um, and I don't know if it's because, like, when I like talk to other like orthodontists, or I hear like them talk, part of it is like we've set our office up, right? For them to change, to really incorporate uh, these things, takes time, and then you have to redo your schedule. And you're right, people come in and like, even for orthodontics, they want a straight smile. That's all. I came in and I just wanted my teeth straight, and I'm like, they're like, they just think I just want this one tooth. I'm like, it's not as simple as just fixing that one tooth. Like
Yeah, it's
it's
the
like a
whole
chain
side.
reaction. There's a
Yeah.
domino effect. And then they're like, how long is it going to take? Yeah, you're right. There is that instant gratification aspect where, it's also the marketing that's put out there too, right? It makes them think that like they can get it yesterday,
Yeah.
right?
And then they're mad that they don't have it yet.
Yeah. Yeah. Or it hasn't worked out as well. And then they're also not as compliant.
Yeah. I you mentioned something before about like bedwetting, and you mentioned some stuff before about like, the tie-in to what you said, possibly like for ADHD, ADD. So a lot of these like, deep-rooted psychological um diagnoses, right? Um do you find that that's all like correlated, like the nightmares, the sleep terrors, the bedwetting, and like the ADHD, anxiety, depression, everything? Yeah.
Yeah. Yeah, absolutely. We know that with bedwetting, what happens basically, I guess, in simple layman terms, is that the body can recognize, fight or flight, right? Sympathetic system has to keep us alive. So if it senses that there is some kind of obstruction, it's going to say, okay, what do I need to do? I have these 10 things I need to get through, but I feel there's a resistance. So the heart rate is going to increase because it wants to put more pressure through to get that oxygen. And then it says, well, where else can I get the oxygen from? So it's not going to get
Mm,
it. Well, we should need it the least from our urinary system. So it pulls it there. And when it pulls it, it takes away that signal to send to the brain when the bladder does fill that we need to wake up and go void. It's a better process as we get older, but for kids, they don't do it. And you see that, like, the more you ask, I mean, it's a really unfortunate and embarrassing situation. A lot of times it's not put on forms. So I would say commonly missed. But I mean, as we've built our reputation and we have a sleep questionnaire, and bedwetting's right on there. And
mm.
I'm actually surprised to see how many more kids bedwet than do not. It's interesting.
Yeah.
Yeah. And like you talked about, like, anxiety and depression, 100% related. After, when you don't nasal breathe properly. Nasal breathing is so important. I actually never understood the value of nasal breathing until I actually got into this. And I was like, wow, one of the smallest things in our
Yeah.
body is like the most vital thing, right? And once you nasal breathe, you keep your body in such a calm state. It
You
stays in this activated state. Then you
gotcha.
start to, like, activate other systems, right? Neurological, emotional, physiological. And like we talked about this the other day in one of the study groups that I was on, was surprisingly after COVID or during COVID, anxiety and depression rose. And it wasn't just because we were in the house, but so many people were mouth breathing,
Oh yeah. Okay.
right? We're wearing a mask. Even I caught myself. I was like, what am I doing? And you started to see these things even in these teenagers. And I work actually now with a lot of psychologists and psychiatrists who thankfully are so open to the fact and the knowledge of breathing and sleep disordered breathing. And they realize that there's a connection. And so before they put them on a drug, right, they may start them on something light just to help them, be able to function and get them to our
Mm.
office. Then we start treating. We open up the upper jaw, which is connected to the nasal passage, and we get them breathing. I do a lot of breathing techniques because we don't breathe properly and we don't really know how to breathe properly at such a young age when you lose that automatic function.
Yeah.
And then, you see their anxiety, their depression goes up, like, reduces significantly. They can socialize, they can hang out with their friends, they can have a life, right? They have energy, they can go and play sports, they just become more active.
Yeah. No, that's fascinating. When you mention it that way too, like the tie-in to the nasal passage and like, the obstruction of that would dictate somebody's ability or something canceled. Nope, we're good still. Pardon me. I think we're okay still. Um Yeah, so like when you mentioned something about like an obstruction or something tying into like the nasal passage, right? It makes sense too, and especially because like there's so much tying into the nervous system and like the nervous system tied to like the muscular system. And like the parasympathetic, sympathetic, all that stuff too, like the fight or flight, right? And that would all tie into somebody having, more anxiety or less anxiety or more symptoms of depression or less symptoms of depression too. So it makes sense and it's interesting. I never thought about it really that much until us chatting more about it today, actually.
Yeah, you see a lot too, with even just how, like, we say a lot, like, hyperventilation and underventilation. Like, we don't even know that we're doing it. We just start to adopt these, I say, abnormal habits because we have to breathe, right? So it becomes so in our subconscious that these changes happen, what seemed like over a period in time, very effortlessly, and we don't even realize that it started to change. And you're right, you start to affect, even, like, I see so much fascia stuff, like, we do a lot of work with, like, craniosacral. And when they can start breathing again, like, you see all the fascia release. Like, it's crazy, these athletes. I mean, when we get into athletes, I think they are the biggest, they're the ones you see it the most because they're moving the most. They have more flexibility. They're just, the demand on their bodies a lot higher, right? They're trading at a higher capacity, and you see, like, the changes. It's pretty unreal but cool at the same time.
Yeah. Yeah. I guess while we're pretty much on that note, let's get more into like the athletics or performance realm of things. So Would you say that for yourself personally, like you just mentioned athletes there, like for most of the people that you work with, are they generally kind of more like general population, or would you say that you have like a nice kind of split now where it's like athletes too?
I would say that split is growing. I still think it's part of the minority of where we are, but I have seen the growth for us over, especially this year. And I think part of that is just our reputation growing and
Hmm.
just getting out there to be able to make those connections with with the athletes and the teams and the physical therapist.
Yeah. Can you, obviously keeping somebody's name confidential, could you talk about a scenario where you had an athlete come in and how they saw the benefits of doing some work with you?
Yeah, I had this 11-year-old boy. Actually, it's funny you mentioned that. And he was one of my first cases. I'll never forget him. I talk about him a lot. Really nice kid. Family history of being in hockey. As we're Canadian, I feel like it's bred into you. Like, if you don't sleep, eat, breathe hockey, you are not part of the Canadian
I
system.
don't. I don't.
Right?
Yeah.
But really good kid. And mom had come to me in she was referred for some obstructive sleep apnea stuff. And as we started talking about these symptoms, she started to say that, she recognized that her son had some of these symptoms. So she wanted me to see him. So I said, sure. Brought him in. We realized, diagnose him. There's some stuff we can do, expand the jaws, grow the bones, really develop. And I remember them coming back in without an appointment, and they were like so ecstatic. She was so happy, almost in tears, because she was like, the coach used to say that, not that he was slow, but they saw such a change in his performance. He was able to recover faster. Even his reaction time to certain things was a lot better. So, a lot less hits on the ice, or potential hits rather. She said he felt better. He was not as moody throughout the day. He slept better. He was just able to recover better. His body, they're training at, like, I mean, they're training 5, 6, maybe even 7 days a week. Like at 11, the I don't know how many people know what the hockey life looks like. I was pretty shocked to hear about it, but it's pretty intense. And he really wanted to go far. He wanted to take it to the pros, right? And so his coach was like, "Holy, like you've changed." His speed increased, his recovery improved, and then he was just able to train at a higher, his body could take a higher output of that training. Nicely enough, he made it all the way to the NHL, and I would never forget when he
Oh.
got drafted. Yeah, in juniors, they brought me before they even released the photo. She brought it to me, and she's like, "I just wanted to say thank you, and he wanted to let you know that he's gonna sign this photo, and this is for you, and he wanted you to know before anybody else that he got selected." And I was like, "Oh, so cool!" Like, she saw the improvements along the way, right? And he just said too, he's like, "I felt better." He's like, "I can't explain it. I felt better. I felt lighter. I felt more flexible. I just felt overall better. I felt clearer in my head." He was like, yeah, he's like, I felt unstoppable.
Yeah. Yeah, no, that's incredible though. But I feel like it all makes sense when you think about it, right? Because like if we're looking at even like performance itself, like a key component of performance is recovery, right? And for somebody to be performing at their best, you have to be able to recover well. And if you're not sleeping long enough, or if you're not getting a good quality of sleep, it's going to be hard for you to actually be recovering from the stimulus that you're placing on your body from whatever you're doing, or like you even mentioned too, like something such as reaction time, or like your ability to perform like a certain skill or sport, like that'll be better if you're actually like more well rested. And like that could just be something where like that one procedure could dramatically change their entire career.
Yeah. And even like they're eating, like, they're at the top of their game, right? Nutrition is so huge. It's another aspect that I like learned about, because as you start going into this, you want to be able to support so many things. Nutrition is so huge. We can't get into that today. That's a whole nother conversation. But I mean, these guys are eating, like they're eating so clean, they're eating so healthy, and yet they're not at their peak performance. So just imagine when you improve one little area and the other areas are already so high, what that performance output's going to look like. It kind of like ignites. It's pretty awesome, actually.
Yeah. And like one thing that I think I see often, or I think even myself and the co-host see often is people abusing stimulants, right? Because of lack of sleep quality or lack of sleep duration, or even just like overtraining, right? Like
Yeah.
maybe they're training too frequently. Maybe it's a combination of things. They're not eating enough food, and they're not sleeping enough. Like I think a lot of it is like routine and schedule based too. But one thing that goes nicely in tandem with it, and is actually today's sponsor of the podcast, is Magic Mind. So
Woo.
this little shot here works in tandem with your coffee, not replacing your coffee, but working in tandem with your coffee. Because we love coffee around here. We'd never tell you to stop drinking that. But yeah, in this little shot here, it's loaded with a bunch of nootropics, vitamins, and minerals, a little amount of caffeine, but it's really going to help with your awareness, with calmness, with your recovery and your performance. And we're very fortunate to also be offering an exclusive discount because we love you so much to people that want to be using our code. So if you go to magicmind.com/ph50, you can get 50% off the first subscription or 20% off the first payment. So I've been taking this for a while. I ran in a women's outfit from taking this thing. I don't know if that's the only reason why, but it gave me the energy to do so. So if you haven't, check them out. They're awesome. And the link will be in the description. Um, but yes, continuing with that stuff there. So I honestly do find it fascinating for the correlation with like just sleep and performance. And even for myself too, like I'm not really a big pusher of melatonin, because a lot of people that I know personally will just like be like, oh, just take extra strength melatonin, and I'm like, that's not good though. It's kind of like it ties into what we were talking about earlier about like the pain medication or the antidepressants, or even taking like anti-inflammatories, right? Like any of that stuff is not really addressing like the underlying problem. It's just going to be giving you like a temporary solution or fix. I'd say like it's similar with just like abusing melatonin, because I'm sure you see it often too, where people are just like, yeah, I just take melatonin every night, and I'm like, that's not good. Like you shouldn't be needing melatonin every night to sleep.
No.
um but like for me, like before I even tell someone to go maybe get, because I will sometimes suggest that they go get like a sleep test done, right? I'll just be like, hey, watch your blue light time before bed. Maybe just invest in a pair of glasses. Do some breath work before bed to change your phone to like a orange or red mode where you're getting less blue light exposure. Take magnesium, see if that helps, right? Maybe even taking I'm a big fan of like a chamomile tea could help, or like even having like some sort of casein protein, something that's like going to slowly digest overnight too. Just things that could help you like in general sleep better, but then also trying to get into a bit more of like a routine with your sleep before just like hopping on to like something that's going to help you sleep in general. But then I will definitely be like, hey, like maybe you should go get your sleep like test it and see if there's like an underlying problem, because end of the day, like I can only do so much on my end. But like that's where this comes into place, where it's like, hey, maybe it isn't just like something else. Maybe it is like a structural issue that's causing you to not sleep or at all. Or sometimes there's a weight related issue tied to sleep apnea too, where people are like, they've
Yeah.
gained a bunch of weight and they can't sleep. But that would all come down to like obstructions or blockages of airways too, right?
Yeah, it all goes in tandem, right? I mean, we know weight is a big proponent for obstructive sleep apnea, right? As soon as we gain weight, it goes to our throat, goes to our stomach. Um, it's like there's so many uh, avenues to the obstructive sleep apnea side, and it can be a little tricky, and sometimes it can be a little daunting and almost discouraging, right? Because there are people that would be like, well, did a sleep study and I'm doing this, but then I gained weight and I had a death in the family, or I couldn't control it, or for different reasons, their eating is not the best, or they're not sleeping. And so I always say, like, the sleep cycle is tricky sometimes. It's kind of cyclic, right?
Hmm.
Because you can start to do like the first five things. Which order do you do those five things? And it's not always going to be the same order for every person. But I mean, I am a big proponent of a sleep study, because you don't know what you don't know, right? You can't treat what you can't see. We can treat the overweight because we can see it, right? We can treat like non-sleeping because we know we're waking up, right? And I agree with you. I'm a big proponent in like magnesium. I'm not. I wouldn't say I'm totally diverse in the nutrition aspect, but the casein protein is kind of tricky. We get a lot of clean people here, and so I'm like, okay, stay in my lane. And the magnesium seems pretty tolerable. I don't get my head bitten off on that aspect. And I agree, magnesium to me over melatonin. I was actually quite surprised to how many kids are given melatonin.
Yeah, I can imagine it's probably pretty intense.
That was sad to see in the beginning. And I just think like we need that instant gratification, right? Like what's easy to pull, what's easy to grab, what's the quick fix, rather than really looking at what is the root cause. But part of that again is not knowing where to go, or being told that some of these things are normal and they'll grow out of it and there's nothing wrong, or maybe having a certain test done and it's negative for something, but we're not really testing for the right thing and missing the true cause of what's happening. So, yeah, I mean, I've seen people go for a sleep study too, not people, and they were told that it's normal, there's nothing wrong with you. And when I actually read the sleep study, I'm like, oh my gosh, like there's so many things in here that indicate that something is wrong, right? And so
Mm-hmm.
they're not, they're brushed off, right? I, I I mean, I'm a big proponent for dentistry. I love my community. I love our airway. I think that we look at things, we're taught to look at things in little minute areas, and we really do dive down into the nitty gritty. You can call us annoying, but we do. I mean, if a patient has a sleep study, I'm one to say like take it to a dentist, like find an airway dentist and do that, because again, like medical is only going to treat medical, right? And dental is only going to treat dental. We're not going to treat the medical side, but there's a lot of things that I find sometimes get missed or misunderstood. And the dentists right now are really in that educational format. They're really, well trained in the airway space, and I believe that we deserve to treat our community better. Give them the information they need, let them make the decisions that they want. I mean, there's so much information available today, which is a whole nother conversation. Sometimes it's a little daunting or misleading, right? Um, but yeah, we have to just do things differently, more collaboratively, right? There's not a one size, one shoe fit all for every single person. That's not the way that you treat.
Yeah.
And you have to give them options, like you said. Like there's so many options: a chamomile tea, magnesium. Like I agree, like get off these phones. Like these kids are on these phones till like they fall asleep with them in their hands or their iPads. So I think we need to change things. There was nothing wrong with the way we grew up. We're fine.
Yeah.
I'm kidding, we're
Yeah.
not fine. Right.
No, and I think a lot of it's like, maybe generational. Like, I think a lot of it is like people just, they had trouble sleeping. So, what were they pushed to improve sleep quality and duration? Well, you take your melatonin, it'll help you sleep, right? But I think, just with the kind of the realm that I'm into is like we should not be too reliant or dependent on these things, right? And if we're able to try to improve whatever variable it may be, and in this case it could be sleep, but trying to improve whatever you can with just different methods or implements, right? And then if you get to a case where you need to seek out some special help, or you need to seek out some sort of professional opinion, that's where it comes into place, where you do have your more like really hyper niche doctors and specialists, right? Where it's like, hey, like you can go to them specifically for this issue. But I think people just generally go to like their GP because they don't know where to go. Um, but I think, like you mentioned before, you kind of alluded to collaboration quite a few times within this too, is I think we need to just have this harmonious relationship, in kind of the health and fitness realm, kind of globally, of like, hey, this isn't maybe necessarily in my wheelhouse or strength. Let me push you to someone who can like help you more with this issue.
Yeah, absolutely. I definitely agree with that. Especially when, like, sometimes I hear like these parents who say that they got their kids tested and the doctor said nothing was wrong with them. Like some of their blood work comes back normal. And that's true. Some of it will, again, depending on what you're testing for. But, I always say like you can only diagnose what you see. So if you're not looking for something else, you may miss something else. Um, and yeah, I mean, from the fitness aspect, I feel like we I have a whole new look on my body now. And like worshiping it in a sense, like treating it better. Like sleep is so important. And like even when I'm going to the gym, I'm not some avid person. I'm no longer playing these athletic sports as I used to when I was younger. But I think about like, oh, I had a good day at the gym yesterday. Why was that? I ate well. I slept well, right? I didn't need as much stimulants throughout the day. When we don't sleep well, we're struggling, right? That workout at the gym becomes harder. You don't want to go to the gym. It just becomes like a drag. And
Yeah.
I feel like we should be, I don't know, like asking a little bit more questions, like wanting to support our body a little bit better, right? Rather than, oh, I'll figure that out tomorrow. Let's just get home and get to bed and another bad night of sleep or poor eating. Like that whole combination aspect can be pretty uh, detrimental overall, especially long term.
Yeah, and I'm sure you've heard it a ton, right? Just people getting to a point where they like think it's the norm, which is getting like 4 hours of sleep. They're just like, oh yeah, I'm just used to it now, and I only need 4 hours of sleep. And I was like, do you though? Like,
Yeah.
like how do you know
Tell
you only need
me.
4 hours of sleep? Yeah,
Yeah.
um,
Tell me
and
how you
like
know that.
yeah, and like even from like a training standpoint too, it's like there's such a huge correlation with like sleep and like cortisol, and cortisol ties into, it's like your stress hormone, like, and that ties into weight loss, and or that ties into weight gain, and like the more stress that we're carrying, we have less tolerance, or we have less capacity or threshold for additional stress, and all of a sudden we're limiting how much we can actually do, and all of a sudden we're like, maybe we're bringing on injuries, illness, whatever it may be, because we're trying to out train like a bad sleep schedule, or we're trying to out train like bad stress management or anything like that. And like, I've been there. I'm sure we've all been there too, where we were like, gym warriors, where we went like 6 days a week, and we're like, I'm okay. I feel fine. And then you have a major injury, and you're like, okay, maybe I wasn't fine.
Yeah, yeah, absolutely. I've done that even when I was like training for my comp, right? I remember I would say, okay, I had to like, we had to work out 5 days a week and cardio was 7 days a week. And, you book these sessions and sometimes I had to book early morning sessions and then you don't sleep well. And I'm like, I am so tired, but I cannot, like, it's too late to cancel. Like, what do? You just go through it. Did I have a good workout? No. Did I come close to injury? Absolutely.
Yeah,
Right? So, yeah, I think like we don't think about, we think like we're road warriors, like we're almost invincible, like nothing's going to happen. Like, and again, if we don't sleep well, we're not in our best frame of mind. Like, we cannot think clearly. I can tell you that I've not made the best decisions on a poor or short night's version of sleep. I'll tell you that much for sure. And when I was competing, like I never felt better. I never felt better in my body. I never felt better in my head. I felt so clear. I remember days I would go without having coffee, and it's weird. Like I like the taste of coffee. I'm not drinking it for this, perkiness or to keep me going. I do genuinely like the taste of coffee. And I remember there were days I'd go without coffee, and I'm like, this is so bizarre, but I have so much energy. Like I had
yeah,
so much energy. I was like at the top of my game. I was remembering stuff. Like I was thriving in so many areas, taking care of my business, like working out, like just overall feeling and health. I felt amazing, but that's hard to maintain.
it is. Yeah, and like I guess one kind of final thing we could chat about while I have you on today is like your competing thing. Like how did that go for you? Because like when did you compete? When was that?
I actually competed in COVID. Was so
Okay.
mad. Like this will be a memory that will stick with me forever. Because our competition date was March 17th, I think it was. And it was just before COVID, like everything shut down. And we almost couldn't compete. They went back and forth, like comps off. And then they were like, well, we've kind of like, talked it out and negotiated and pushed for you guys. And the competition's back on. And then, okay, for you guys to go, there's going to be nobody in the audience. Like it was just crazy. And I remember saying, I mean, at that time, you're like, it was like peak week. So I don't know how much you know about comps, but in the last 10 days, it's kind of like when you try to like flush everything out, you try to look your best, you try, and you're not in your right frame of mind. And I remember being so tired and just like all the things that I had. Like I remember people talk about like, oh, it's so hard. I'm like, my comp prep was so great. Like I still had carbs like up until like close to the end. And I was still able to have like diet soda, like no calorie stuff. And that stuff held me over. But when we had to cut all of that out for peak week, my body definitely felt like it felt a dip. And I remember saying, like, I dieted for 5 months. I'm walking on some stage. I don't care what stage. Like, this is not happening. Like, I didn't do this to then be stuck in my house. I remember I was so mad. But thankfully, we were able to compete. I mean, we were able to have an audience. Even our coaches were even allowed in the on the stage area, like in that where the audience would be. No one was allowed. It was so quiet. It was so desolate. We just had ourselves and all the people competing. But it was a great experience, actually. It was a really great experience.
Nice. Yeah, no, I feel like it's in that case, like where something of that nature happens, you just kind of have to make the best of this of the situation. So it's good that you were still able to compete to some degree because, like you mentioned, to go 5 to 6 months through a prep and then not be
Yeah.
able to compete would be brutal. So it's good that you were still able to compete, and I'm sure it was like still a cool experience regardless, right?
You become a little vain too, in a way, because like you work so hard, you see the changes in your body. I was like, I want to like show it off. I want to compete. I want to do like it was my first comp. I wanted to do the next steps. I wanted to like live it all and feel it all. And I was like, oh my God, who's gonna like what I don't get to wear this like, bikini that I bought, like this outfit. Like I was like, what am I gonna do now? You kind of go through these roller coaster of emotions and it was like, oh, but yeah, we kind of came out of it. But it was a good experience. I mean, I I would recommend it to anybody. And I laugh because like people have these stories, but I mean again, from an overall feeling and like I had never felt better. I cannot explain how clear in my head I was. I was sharp as a whistle. Like it was just a great feeling. It was a great experience.
I wonder if it's all because of the sleep stuff. That must be why you were feeling so good.
Well, I'll tell you the truth. The days I did not sleep or shortcutted my sleep, I definitely felt it. But when I went to bed like on time or early, I definitely like felt significantly better the next day. But then there's also the other things like I was losing weight, so I was more within my BMI. I was also eating really well as well, right? So I do think it's a combination, and it just goes to show like I was eating well and exercising, moving, and if I didn't sleep enough, I didn't feel good the next day. So
Hmm. Hmm.
I do think it's a big component. It's a big component. It's all important. Nutrition, um, mindset,
Yeah.
moving, like, exercise is so important. And even if it's just a walk, like it makes such a difference.
For people that are listening that do compete, there's your sign to sleep more or
Yeah,
to get your.
yeah. Give it to your body. Like I'm telling you, do not shortcut the sleep. I mean, don't shortcut the sleep. You'll feel it makes a big difference in how you feel the next day and day after.
am- Amazing. Just to quickly wrap things up, what would be one piece of advice or a couple that you'd give to somebody that's like trying to sleep better? They've been dealing with sleep issues for a while, and they don't really know that next step for themselves.
Um, Sorry, Bryce. Can you repeat that? You cut out there for 1 second.
So for someone who's maybe they've been dealing with sleep issues for a while, or they don't really know what's going on, but they're experiencing the signs of fatigue or overtraining, like we're talking about, and they're experiencing those things impact their life in general. What would be like a general piece of advice that you'd give them?
I would Yeah, I would say get a sleep study. Knowing what I know now, I would say get a sleep study. Because if you're feeling fatigue and you're kind of doing all what seems to be the right things, right? You're respecting your body, you're moving, you're in the gym. I mean, that's the next step. Obviously, there's something that's just happening in that breathing component that's not allowing things to be as smooth as they should be. That's really the only key piece to seeing what's really going on. underneath all of our fun stuff that we have going on. And I say that, I know I'm trying not to be biased on the dental side, but I know that I am. I mean, I you see so much, whether it's a sleep study or like a CBCT from a dental office, like you really do see. I feel like that's the missing piece. I've been able to help so many people, change how they feel and breathe because we've x-rayed them and we've seen what that looks like and given them options to be able to open up their airway and breathe better. So that's my 2 cents from the dental side.
Amazing. Well, thank you so much for coming on today. This was a great chat with you. For people that want to stay up to date with you and the many things that you're doing, where can they do so?
Yeah, I mean, thank you so much for having me. I really appreciate it. I definitely love sharing this information. They can follow me on either bloom.dentistry. That's on our Instagram handle. We're also on TikTok. We're also on Facebook. My personal Instagram is C like Charlie Jonelle, Jonelle. And yeah, I'll see you around.
Thank you so much.
Thanks, Bryce.